So I was actually able to find a copy of the video from the school board meeting in November of 2016, where they discussed a proposed bathroom bill for transgender students. Dr. Diane Krall, who is actually currently a member of the Morton School Board, spoke at that meeting. In this video, I'm going to break down her speech and debunk a couple of the anti-transgender things she said during that meeting.
Good evening. My name is Diane Krall, and I am a local family physician with 2 children in Grundy Elementary School. I wanted to stand and talk to you tonight as a mother, but I have to speak a little bit from the perspective of a family doctor. I believe that the transgender issue in grade school children is not sufficiently supported in the medical literature to support any change in our current gender assignment for toileting, changing clothes, etc.
Now, in her defense, the studies we now have obviously had not been out in 2016 when she gave this speech. Having said that, there was plenty of evidence to refute this claim that I'm going to get to a little bit later.
I am for this privacy policy. I think that it protects Morton's kindness and protects what we have been doing as a community all along.
Yeah, see, that's kind of the problem, because the thing we had been doing all along was making these kids feel ostracized and like something was wrong with them. That's not kind.
The World Professional Association for Transgender Health notes in their latest standards of care that gender dysphoria, which means not liking your gender.
No, it doesn't. That's not what it means. Maybe we should stop trying to give medical information on topics that we are not educated on. So gender dysphoria is the psychological distress that results from an incongruence between one's sex assigned at birth and one's gender identity. Not liking your gender.
Does not inevitably continue into adulthood, and only 6 to 23% of boys and 12 to 27% of girls treated in their clinics showed persistence in their gender dysphoria into adulthood. Further, most of the boys' gender dysphoria desisted, and in adulthood they identified as gay or homosexual rather than transgender.
Oh boy, okay, so this one's a doozy. So let's start off by saying she's not exactly wrong here. She is talking about the standards of care 7. Having said that, she left out a lot of context. Are the statistics she quoted here included in the standards of care 7? Yes. What she fails to mention is that the years those studies were done were 1984, 1979, 1987, 1994, and 1995, which means those statistics at the time of this speech were 20 years old. What she further fails to mention is that the sentence exactly following those statistics follows up on adolescents. So these are pre-pubertal and above, 11 or 12 and older. Of the 70 adolescents that they followed through into adulthood, every single one of them remained true to their gender identity. Convenient omission, don't you think, Dr. Krall? Now, I have a really good video that breaks down all the current studies on not only how we can help transgender youth, but also on detransition rates. If you are interested in hearing all about those studies, you can click here to watch that video. But the end result is that of young children, so those pre-pubertal, the statistics that Dr. Krall was just talking about, detransition rate is 5%. That means a 95% persistence rate. It's even higher in adolescents.
The American Psychiatric Association Task Force on the Treatment of Gender Identity outlined actually 3 different approaches for how to treat prepubescent or pre-puberty gender dysphoric children. There's no medically or psychological standard for a change in how grade school children are currently gender assigned.
So the only task force report I could actually find was from 2012. So keeping in mind the speech was in 2016, I'm not really sure I'd call that recent. Having said that, I find it very interesting that Dr. Krall doesn't talk about the three options here. Yes, there are three options for how to treat children with gender dysphoria. The first one is to do nothing and encourage them not to live in their expressed gender. The report actually recommends against that. The other two options are to help them socially transition by supporting them in the schools with, I don't know, letting them use the bathroom of their choice. And the third is actually to treat them with puberty blockers and hormones. Kind of funny omission there, isn't it, Dr. Krall?
The junior high and high school gender nonconformity is better studied medically, but it continues to only have small studies that are always observational and therefore impossible to clear from bias.
Of course they're small studies, and when she says small, we're talking 30, 40 kids here, but that's because this disease is not that common. We're not going to be treating thousands of children. So yes, they are small studies, but that does not make them relevant, and they are not observational. So this is just plain wrong.
The professional opinions and position statements of the American Academy of Pediatrics and also the American Academy of Family Practice, of which I am a fellow, reflect only expert opinion. And those organizations exhort their physicians not to practice medicine on a daily basis based on expert opinion.
This is the one that confuses me the most because I don't understand if she's saying expert opinion doesn't matter. So does Dr. Krall never refer her patients to specialists? And when she does she just tell them to ignore what the cardiologist said because he's just an expert? This just doesn't make any sense to me.
We are to wait and get medical evidence and then change our practices and treat our patients. The other concern that I have as a physician is that there is no evidence that allowing a transgender child or teenager to use the facility of their choice actually increases the social connectedness that we feel may help with their depression, suicidality, feeling of being isolated.
Wrong again. So I guess like the studies don't specifically look at the bathroom, but they do look at acceptance in the school environment. And the studies have very conclusively showed that acceptance within the school environment decreases the amount of depression and suicidal thoughts in transgender youth.
As our school board, this is where you have the responsibility that I can relate to, taking opinions, a large body of conflicting evidence.
No, the evidence actually isn't that conflicting. It's pretty clear cut that treatment and social acceptance is extremely important in decreasing rates of depression.
And then trying to translate that for the people that you feel entrusted with. I also can identify with making decisions with lawyers looking over your shoulders. And I would exhort you to be strong. I do not see the Illinois Trial Lawyers Association in my office every day as a patient, and I have to remind myself of that sometimes. And your responsibility are our children and the truth and the inalienable truth that we are all created by a perfect God who doesn't make mistakes.
No, I take it back. This is the one that always confuses me the most. God makes no mistakes. What is cancer? What is diabetes? What is wearing glasses? Those are, I guess you could say, biological mistakes, but they're things we treat, right?
And helps guide us, and the fear of him is the beginning of wisdom. Thank you.
So besides the fact that Dr. Krall's speech is pretty obviously very anti-transgender, my biggest issue here is she is deliberately misrepresenting the evidence and the facts that she is presenting. It's not that she doesn't know how to interpret them. She has picked and chosen what she would like to present to try to sway your opinion. And that is not only unethical, but dangerous.